How to inject Menopur with a Q-cap, intramuscular. Presented by Fuze Health. How to store your medication. Store Menopur at room temperature or in the refrigerator until the expiration date on the label. Once it's mixed, it must be used immediately, and any unused portions should be discarded. Supplies needed. You'll need 1 vial of diluent, at least 1 vial of Menopur 75 IUs powder, depending on your dose. For example, if your dose is 75 IUs, you will need 1 vial of powder. If your dose is 150 IUs, you will need 2 vials of powder. If your dose is 225 IUs, you will need 3 vials of powder, and so forth. For today's injection, we will prepare a dose of 150 IUs, or 2 powder vials, 1 3 ml syringe, 1 Q-cap, 1 injection needle, alcohol swabs, sharps container, gauze or tissue, optional. Examining your medication. Before starting, wash hands thoroughly, work on a clean surface, and inspect your vials. Ensure the powder vial has no cracks and contains the powder inside. Diluent should be clear and particle-free. Prepare the medication. Flip off the caps from all your powder and diluent vials and wipe the rubber stoppers. Peel off the seal from the Q-cap, but don't take out the Q-cap. Place the vial of diluent on a flat surface and push the spiked end of the Q-cap into the rubber stopper until it snaps into place. Remove the plastic blister pack. Unwrap the syringe and pull back plunger to draw air into the syringe that matches the amount of diluent you are instructed to mix with. For Menopur, it's typically 1 ml. Twist the syringe onto the connector end of the Q-cap. Slowly inject the air. This step makes it easier to withdraw the liquid because the vials are pressurized. Invert the vial and withdraw your prescribed diluent amount, for example, 1 ml. Flip the vial back and remove the Q-cap and syringe from the vial as a single unit. Discard the used vial of diluent and any remaining content inside. Locate your first Menopur powder vial and push the spiked end of the Q-cap into the stopper until it snaps into place. Slowly inject the diluent. Menopur powder dissolves instantaneously, but you can still swirl the vial to make sure it's thoroughly mixed. Do not shake the vial. Invert the vial and pull back the plunger to withdraw the entire contents of the vial into the syringe. Don't worry if you're not able to withdraw every last drop. This will not impact your dose. You have now mixed 1 vial of Menopur powder for a dose of 75 IUs. If your dose is 75 IUs, you are done mixing and can skip to the injection steps. If your dose is more than 75 IUs, continue to the next steps to mix your subsequent powder vials. Remove the Q-cap and syringe from the vial as a single unit. Locate your second Menopur powder vial and attach the Q-cap and syringe to inject the mixed solution. Swirl to make sure it's thoroughly mixed, but do not shake. Invert the vial and withdraw the entire contents of the vial back into the syringe. You have now mixed 2 vials of Menopur powder together for a dose of 150 IUs. If your dose is 225 IUs, mix 1 more vial of Menopur powder with this solution. If your dose is 300 IUs, mix 2 additional vials of Menopur powder, and so forth. After you are done mixing, detach the syringe from the Q-cap. Discard the Q-cap and empty vial into the sharps container. Switch to your injection needle. Tap out air bubbles and push the plunger gently until a droplet appears. How to do an intramuscular injection. The upper outer quadrant of the buttock muscle is the most common location for an intramuscular injection, but always check with your provider to ensure you are injecting at the right location. Tips to reduce injection discomfort. Warm the vial or filled syringe before use. Ice the injection site before injection. After injection, massage the injection site and apply a warm compress. Rotate injection sites. You are now ready for your intramuscular injection. Clean the injection site with alcohol. Firmly stretch the skin at your injection site with your thumb and index finger with your non-dominant hand. Hold the syringe in your dominant hand. Insert the entire length of the needle into the stretched skin at a 90-degree angle with one swift motion, similar to a dart. Stabilize the syringe with your free hand and pull back slightly on the plunger. If you see blood, do not inject the medication and withdraw the needle. Apply pressure to the injection site with a gauze or tissue, and discard the syringe into the sharps container. Repeat your medication preparation process and inject at an alternate site. If there is no blood, the needle is inserted properly and you can inject the medication. Slowly push on the plunger until all of the medication is injected. Quickly withdraw the needle and discard it in the sharps container. Apply light pressure. Bleeding, bruising, or redness at the injection site is common. You might also see a drop of liquid come out of the injection site. This is common and should not be of any concern. Great job! You have completed your injection. If you have any questions or need support, contact your healthcare provider or reach out to Fuze Health.